Hello everyone. Welcome back to our weight loss channel. In this video, you will learn about the criteria you must meet to have weight loss surgery. In case you are new here, then don't forget to like, subscribe, and ring that bell for more informative content. Let's get started. Here you will learn about the criteria you must meet to have weight loss surgery. In this procedure, the surgeon removes a large portion of the stomach to create a tube-like sleeve. Weight loss surgery is only one part of an overall treatment plan. Your treatment will also include nutrition guidelines, exercise, and mental health care. You'll need to be willing and able to follow this long-term plan to achieve your weight loss goals. If you're considering weight loss surgery, you'll meet with a number of specialists to help you decide if weight loss surgery is an option for you. Medical guidelines. The general medical guidelines for weight loss surgery are based on body mass index, BMI. BMI is a formula that uses weight and height to estimate body fat. Weight loss surgery might be an option for an adult with a BMI of 40 or higher. The surgery may also be an option for an adult who meets these three conditions: BMI of 35 or higher, at least one obesity-related medical condition, at least 6 months of supervised weight loss attempts. In some cases, weight loss surgery may be an option for adolescents. How to know if you're ready for surgery. If you're considering weight loss surgery, you'll meet with a healthcare team that may include the following: primary care doctor, surgeon, anesthesiologist, dietitian, a nurse specializing in weight management, psychologist or psychiatrist, other specialists depending on your medical conditions. Members of your team will explain what to expect before and after the procedure. They will evaluate whether you're ready for surgery and help you decide if it's an option for you. They may identify concerns to address, medical, behavioral, or psychological, before you're ready for surgery. Medical concerns. You'll have a medical exam to diagnose any unknown obesity-related conditions. Your doctor also will test for problems that could make surgery more complicated. You may undergo tests for sleep apnea, cardiovascular disease, kidney disease, liver disease. You'll likely not be able to have surgery if you have these conditions: blood clotting disorders, severe heart disease that prohibits the safe use of anesthesia, other conditions that increase the risk of using anesthesia. Weight loss after surgery depends on your ability to change behaviors in eating and exercise. Also, being in good mental health is important for the demands of following your treatment plan. Your team's goals are to identify psychological or behavioral risk factors, address any problems, and decide whether you're ready for surgery. Your healthcare team will talk with you about the following: motivation. Are you motivated to embrace lifestyle changes, set goals, and educate yourself about healthy nutrition? Your team will track your ability to follow recommended changes to your diet and exercise routine. Weight loss history. What dieting and exercise plans have you used in the past to lose weight? Did you lose weight or regain weight? Patterns in weight loss and weight gain can help your team understand your challenges and recommend strategies for post-surgical plans. Eating behaviors. Irregular eating behaviors or eating disorders may contribute to obesity. These include binge eating, nighttime eating, and unplanned grazing between meals. Some eating disorders are associated with other mood disorders and other mental health conditions. Mood disorders. Depression, anxiety, bipolar disorder, or other mood disorders are associated with obesity, and these conditions may make it difficult to manage your weight. Also, people with untreated mood disorders often find it difficult to stick with new diet and exercise habits after surgery. Alcohol and drug use. Problems with alcohol or drug use, as well as smoking, are associated with poor weight loss and continued substance use problems after surgery. Untreated or unmanaged problems likely prohibit the option of weight loss surgery. Suicide risk. There is an increased risk of suicide among people who have undergone weight loss surgery. The risk is higher among people with depression, anxiety, bipolar disorder, substance use disorder, schizophrenia, or other disorders. Pre-surgery expectations. If your team members recommend bariatric surgery, they will work with you to develop a treatment plan. This may include nutrition guidelines. The dietitian will help you with nutrition guidelines, vitamin supplements, and menu planning. The guidelines include changes before and after surgery. Exercise plan. A nurse, occupational therapist, or other specialist will help you learn appropriate exercises, develop an exercise plan, and set goals. Weight loss. You may be encouraged or required to lose some weight through diet and exercise before you can have surgery. Psychotherapy. You may be required to begin talk therapy, drug treatment, or other mental health therapy to treat an eating disorder, depression, or other mental health condition. Your therapy may include developing new coping skills or addressing your concerns about body image or self-esteem. Smoking. If you smoke, you'll be asked to quit smoking or participate in a program to help you quit. Other treatments. You'll be expected to follow treatments for other medical conditions. These requirements are intended to help you achieve the best possible weight loss outcomes after surgery. Also, your ability to follow through on these plans will show your team how motivated you are to follow guidelines after surgery. You will need to consider the benefits and risks and follow through with pre-surgery and post-surgery plans. If you find this video useful, don't forget to like and subscribe to this channel to make a lifelong commitment to a new nutrition and exercise program. Thanks for watching.